Voluntary workouts over at Ohio State for the athletes there are on hold after the latest round of coronavirus testing.
University not saying how many people tested positive for COVID-19, but we know that men's and women's sports are impacted right now. Those sports include football, men's and women's basketball, field hockey, men's and women's soccer, and women's volleyball. Ohio State not identifying which teams or athletes have positive COVID cases, just that the workouts are being paused. Student athletes are not training at Ohio University either. After 8 athletes there tested positive for COVID-19, they have been asked to return to their permanent homes, self-isolate, follow health protocols. The Athens Department of Health doing contact tracing now just to see who else may have been exposed in this. We're in a really scary spot for sports.
And this is a big deal because we were just talking about this sitting around in the newsroom here, talking about what's happening in other states. Ivy League schools now canceling their sporting events for the fall.
Yeah, and if you have one conference starting out saying this is what we need to do, you have to believe that there are others going to follow in suit. That's what we're going to talk about as a fast feedback question today. As we talk about Ohio State, how are you feeling right now about whether or not you're going to get a chance to see Ohio State football?
Yeah, and of course, like you said, when one conference does it, some other conferences will follow suit. But Big Ten means big money. And I know they're not trying to put dollars.
The university.
Absolutely.
And if we're talking about money, football drives the universities, especially in these big programs, especially at places like Ohio State. And if you can't
we are a football town right here.
This is it. Now, the NFL continues to say we're going to move forward. But if you have other sports who simply can't get it done, even without fans in the stand, you're going to have a very difficult situation.
Because look at how many baseball players said they do not want to play. They've got family, they've got children, some of them with underlying conditions. They don't want to risk playing a shortened season.
Everybody is now in a position, no matter what they do, even as we approach schooling, where people are opting out.
Right.
How many teachers are going to opt out in this year where they have sabbatical years and a potential to be able to move on? We've got so many more questions as these cases continue.
Yeah, and I think people just want to know what the plan is. And I know we have so many districts here in the state of Ohio, and it's up to each superintendent, each district to come up with their own plan of what they're going to do. But I think a lot of them are looking for a little bit more leadership on this one. They're looking for a little bit more guidance on what to do.
Well, we're in a situation now in Franklin County where we're dealing with that level red, and we're hoping that it doesn't go to a level purple.
That purple. That purple means what?
The purple means that we're shutting back down again as you go into this. The 7 cases, as I run through them real quickly, new cases that we have, new cases for 5-day sustained period, proportion of non-congregate cases, and the governor is now approaching, so we'll continue that list later. Let's listen in on the governor.
Tim Schaefer of Lancaster is a grad, as is Liz Conley, Deputy Chief of Staff in the Ohio Senate. Another former staffer of mine, Jesse Shamp, is also an alum. Birthdays today, members of our cabinet, Ryan Gies, Ohio Department of Youth Services Director, Sherry Maxfield, Ohio Department of Commerce Director, Dan Tierney, our press secretary. Happy birthday to all of you. Last week we talked about the minimum requirements and steps that K through 12 schools will need to take to reopen. Today we want to talk about our colleges and universities. 167 institutions of higher learning in the state of Ohio. We are very, very proud of these schools, both public and private. Ohio is blessed to have them. They also, of course, are preparing to start up school again, and for most of them, returning to campus. Colleges and universities really drive our economy. They drive the local economy of that village or city, but they also drive our economy in many other ways. They train our future workforce. They're major employers. They conduct the research in health and technology that makes Ohio a national leader. That's why we're going to do what we can to support them in this endeavor. The Ohio Department of Higher Education, in consultation with our colleges, universities, the Ohio Department of Health, and health experts across the state, produced guidance for our campuses to reopen for students, faculty, and staff in the safest way possible. And I want to give a shout out to Randy Gardner, the Chancellor, who has worked tirelessly on this along with his team and had a lot of conversations with our colleges over the last several months. We are releasing guidance today. It is at www.coronavirus.ohio.gov, coronavirus.ohio.gov. This includes minimum operating standards that should occur on all campuses in the state, as well as best practices to further enhance those standards. By implementing these minimum requirements and implementing best practices, our higher education communities continue to educate students and prevent the spread of COVID-19. Ohio's 2-year and 4-year colleges and universities are unique communities of students, faculty, staff, and as they plan for their operations this fall. Testing will be an integral part of their comprehensive strategies to stop the spread of COVID-19. Each of Ohio's campuses must identify how it can best implement COVID-19 testing within the institution. Each campus must develop policies and procedures tailored to their particular campus, their particular community, all related to COVID-19 testing and the isolation of those students who are showing symptoms, those faculty and staff members as well. Testing of these individuals showing symptoms should certainly take priority over all other testing tactics. Testing, we would hope, would be completed within a short period of time after it's done so that they can take the appropriate action. It is recommended that each campus either designate a university housing space to be set aside or secure a local living space to be left empty so that it may be useful to rapidly relocate individuals who live in residence halls, fraternities, sorority houses, or other institutional affiliated housing, those individuals who become symptomatic. Now, we know that this costs money. We know that COVID-19 prevention efforts, safety precautions, educating students this school year in a safe and healthy environment will be certainly more expensive than it has been in the years past. And that is a significant burden. So to help address these increasing costs, I've spoken and worked with Speaker Householder, Senate President Larry Obhoff, as well as Democrat leaders Yuko and Sykes. All 5 of us have looked at this. All 5 of us have had our teams working on this, and we believe we have come up with something that will be very helpful to both our K through 12 schools, our K through 12 schools, as well as our colleges and universities, both public and private. To start that, we're requesting that the controlling board that's scheduled to meet, I believe, on Monday, approve our initial request on Monday to allocate $200 million for higher education and $100 million for K through 12 from the Coronavirus Relief Fund to help meet these increasing costs. As I said, we hope to have additional money. And the figure that we have been talking about for example, K through 12 is certainly higher than that initial $100 million, but we wanted to get this $100 million out, and we wanted to let the schools be able to plan based upon that money coming. As I said, this money comes from Federal CARES Act dollars. I want to thank our members of the of the federal Congress, both in the House and the Senate, for providing these CARE dollars. Funding comes from Federal CARES Act dollars, and schools will be able to use it to meet their unique individual needs. We intend for this funding to be flexible. For example, and these are just examples, a community college may need assistance funding testing at their student health center. A school district, a local school district, may need a nurse to help with symptoms assessment. A university could use funding to purchase PPE. These are just all examples of many things, many ways that this money could be spent. Some may even choose to use this funding to provide connectivity to students and grow distance learning options. The bottom line is that we intend these funds to be used to serve students to prevent the spread of COVID-19. And again, we want our kids back in school. We want them safe. And this money will help achieve that. At the K through 12 level, we intend to make the funding available to all public and private schools. For Ohio's higher educational institutions, we plan to make this available to 2- and 4-year colleges and universities, both public and private, including adult career tech providers. To put it simply, if you educate students in Ohio, we want to provide additional support with some of the federal funding that we have available. Our request is from our request in regard to the controlling board that we're asking the controlling board. There is additional money, though, that I would point out that is being made available through the CARES Act for education in the state of Ohio. $440 million in direct CARES Act funding is available for our K through 12 schools. $440 million. This is money that when they incur a cost, that they can draw this money down. The state's colleges and universities also receive more than $190 million of direct federal funding. So the two figures I've given you, $440 million for K through 12, $190 million for higher education in the state of Ohio. That is in addition to the money that we're asking the state controlling board to approve on Monday. We hope that schools take advantage of this funding. We certainly realize, however, that it may not cover all of the increased expenses schools face during this pandemic. We're going to continue to look to see if we can provide additional funds in the future, but we wanted to get started with these dollars. I want to talk about a homelessness grant. In April, I announced a $1 million grant to the Coalition of Homelessness and Housing to support homelessness prevention efforts and to rapidly rehouse individuals and families who were, in fact, experiencing homelessness. Those experiencing homelessness certainly can be at great risk of contracting COVID, especially those in congregate facilities such as homeless shelters. Therefore, it is important to do everything we can to keep them out of those situations. With these resources, we're going to be able to keep hundreds of Ohioans safely housed during this pandemic. Today, I'm announcing an additional $15 million grant to ensure Ohioans can maintain their housing during this time. COVID-19 is still very, very much with us. I don't have to remind anybody of that. And these resources will help thousands of families across our state stay housed, stay healthy, and get ready for the future. We are all now, as the virus spreads, we're all starting to experience knowing people who have come down with COVID-19. We received word today that someone on my staff has tested positive for COVID-19. The individual has been working from home since the start of this pandemic. We wish the person the best as they recover. And this, I guess, is just a reminder for everyone that this virus is very, very, very much with us. Let's go and look at the data for the day. First, we'll start with the key indicators. And again, starting with the cases, we're seeing cases hover above 1,000 a day, which is significantly higher than certainly they were before. We're reporting today 1,150 new cases that we've learned about from local health departments during the last 24 hours. This is a little bit lower than our peak last week, but it's still considerably higher than where we were 3 weeks ago. This is consistent with the pattern we've seen and are continuing to see where the number of new cases is much higher than it was. Looking at the rest of the data, you'll see here the deaths the last 24 hours were where 15 of our fellow citizens. The 21-day average is 18, so that's a little bit under that. The hospitalization is up above the 21-day average. That's 81 versus a average of 70 for 21 days. And the ICU admissions is up a little bit statewide as well. And when we get to the further data, we'll kind of look at this as it breaks out by region of the state. Let's look, Eric, at the next one. And let me just also point out that these are some of these are in fact lagging indicators, certainly in regard to hospitalization. And when we get to new cases, that is even further out before we see people go to the hospital or we see them get into ICU. Let's look at the, this is the current confirmed COVID-19 patient count in Ohio hospitals by day. The previous slide depicted the number of new COVID-19 hospitalizations that we have reported. This slide also looks at hospitalizations, but it shows the daily number of COVID-19 patients that are currently in Ohio hospitals. You can see from this slide that on June 26th, for example, there were 619 COVID-19 patients in hospitals around the state of Ohio. Since then, we've increased that. And as of today, a snapshot as of today, 905. So June 26, 619, today 905 COVID patients in our hospitals in the state of Ohio. During the past few weeks, this increase has been steady, which is certainly concerning, and as we see these numbers go up. Let's turn to the next slide, which is the testing and positivity slide. We continue to increase our testing capacity in Ohio during the last few weeks. We know that testing is an important component of the ongoing monitoring of this virus. We do see a kind of a different effect, and I asked our team about this today. This is a number we look at. We have positivity numbers statewide. So in other words, of the tests that were done, what percentage were positive? Snapshot, the last day we have available, 6.4. That has hovered between 4 and 6 for some time. This is a higher number. We don't particularly like that number, but we are seeing, for whatever reason in reporting, that on the weekends, the positivity number is just less. And that may be who's getting, obviously it's who's getting tested, where they're getting tested, so we're not really sure. So the most important thing is really to look at this in a 7-day average. And I'm going to try, we'll try in the future not only to show you this for the day, but I think the 7-day average gives us probably a much better look at what is going on. But the positivity rate reported for July 7th, which is was 6.4%, which is Ohio's highest since May 25th. Since May 25th. Now we're going to look at the new risk level map. And you will obviously see some changes, and I'm going to go through that. We're going to do this once a week. We're doing it basically on Wednesday. Once the Wednesday data comes out, then our team starts working with that data. Our data team has been working, analyzing the data over the past week, updated the status of our counties on the public health alert system. I want to remind everyone that there are a number of different data points that we look at. 3 of the data points have to do with cases. The team looks at new cases per capita. They determine if there is a sustained increase in new cases. They look at the proportion of cases that are not in a congregate setting. Another group of indicators looks at symptoms. They look for a sustained increase in emergency department visits, sustained increase in outpatient visits, such as people going to see their doctor's office with suspected or confirmed cases. The team also looks for sustained increases in new COVID-19 hospitalizations and increase in intensive care unit bed occupancy. Additional indicators that will ultimately be factors, but are not yet, will include contact tracing, test per capita, and percent positivity. We do not have, for example, the test positivity broken down yet. We don't have the ability to do that by county, but we are certainly looking at that. And again, to review, counties that meet 0 to 1 indicators are Public Health Advisory Level 1, yellow. Level 2, orange, is triggered when 2 to 3 public health indicators are met. For counties that meet 4 to 5 indicators, they're listed as Level 3, which is the red counties. Once a county is at Level 3, the additional factor that then comes into play is that they cannot improve their risk level category unless cases drop below the Centers for Disease Control and Prevention's threshold for high incidence. And that is 100 new cases per 100,000 people over the last 2 weeks. For a county to be considered Level 4 or purple, a county must trigger 6 or more indicators during 2 reporting periods in a row. Once a county is at a Level 4, it cannot improve its risk level until it has not triggered 6 or more indicators for 2 consecutive reporting periods. So let's look at the map, and we'll kind of go through these counties one by one. Let's start with Hamilton County. Hamilton County, you'll see, has moved up. It was red. It is now on what we call the watch list, which means it basically has met the criteria to go purple, but we're going to allow a week to elapse and look at the data again another week before we actually move it into that purple and before it looks purple on the map. Hamilton County. During the last 3 weeks, Hamilton County's COVID-19 cases increased along with several other healthcare indicators. Between June 24th and June 30th, Hamilton County had 1,124 cases reported, the largest number of COVID-19 weekly cases reported there since the beginning of the pandemic. From June 16th to June 30th, the average new cases per day doubled, excuse me, from 82 to 161. 82 to 161. Excuse me. One of the things that the data team reminds me is that on a lot of this data, once you hit July 1, the data is incomplete. So you may see us referring, for example, to another period, June 16th, as I just did, to the 30th, where we said the new cases per day doubled from 82 to 161. We're citing that because July 1 onward, that's still fluid, and those cases are still coming in. As my team reminds me, due to clinical and reporting lags, these numbers may continue to grow for this reporting period. The community continues to experience early signs that more people are seeking medical care for COVID-19 in Hamilton County. For example, from June 16th, if you look at June 16th and June 30th, visits for COVID-19 to the emergency department doubled from an average of 11 per day to 22 per day. More people are also visiting their doctors and being diagnosed with COVID-19 between June 16th and July 2. Average outpatient visits more than tripled from 52 to 172 visits per day. In recent weeks, over 86% of the cases are not in congregate settings, again, signaling significant transmission in the broader community. Hamilton County also hit a new threshold for the overall utilization rate for regional intensive care unit beds, which exceeded 80% during 5 of the last 7 days. And so that last indicator is an indicator for that is used by the region as well. So you'll see that indicator used for Claremont County as well as Butler County. That's the only indicator that is regional because that's how people use ICU units. Someone, for example, in Butler County may, if they're ICU, they may certainly be in Hamilton County. So that metric moving up had an impact on those 3 counties that you see in the farthest southwestern part of the state of Ohio. Let me move to Butler County. During the last 3 weeks, Butler County's COVID-19 cases increased, along with several other health care indicators. Between June 24th and June 30th, Butler County had 181 cases reported, the largest number of COVID-19 weekly cases reported for them since the beginning of the pandemic. From June 16th until July 3rd, the average new cases per day doubled from 15 to 29. Due to clinical and reporting lags, these numbers certainly may continue to grow for this reporting period. The community continues to experience early signs that more people are seeking medical care for COVID-19 symptoms. From June 16th, July 4th, visits for COVID-19 symptoms to the emergency department tripled from an average of 2 today to an average of 7 today per day, 2 per day to 7 per day. More people are also visiting their doctors and being diagnosed with COVID-19 between June 16th and between June 16th and July 7th. The average outpatient visits more than doubled from 15 to 38 visits per day. Again, these are the early indicators. And again, as every county in that region did, Butler also hit a new threshold for the overall utilization rate for regional intensive care unit beds, which exceeded 80% during 5 of the last 7 days. Again, that is an indicator that is a regional problem because that's where individuals go regionally for intensive care unit beds. Let's jump up to Cuyahoga County. During the last 3 weeks, Cuyahoga County's COVID-19 cases increased, along with several other health care indicators. Between June 24 and June 30th, Cuyahoga County had 999 cases reported, the largest number of COVID weekly cases reported since the beginning of the pandemic. From June 16th until June 28th, the average new cases per day more than doubled from 66 to 151. Most of the cases in Cuyahoga County were in non-congregate settings during the last 3 weeks. Cuyahoga County residents are seeking care for COVID-19 related concerns at higher levels than ever before. For example, from June 16th, July 1, compare that, visits for COVID-19 to the emergency department more than doubled from an average of 19 per day to 50 per day. Over the same period, the average number of outpatient visits with suspected or confirmed COVID-19 diagnosis increased from 41 to 233. 41 to 233. And that was the average number of outpatient visits with suspected or confirmed COVID. Finally, more residents of Cuyahoga County were admitted to the hospitals for COVID-19. The average hospital admission per day more than doubled from 7 on June 6th to 20 on July 2nd. Let me go back to Claremont County, and again in our same region of the state. During the last 3 weeks, Claremont County's COVID-19 cases increased, along with several other health care indicators. From June 16th until June 30th, the average new cases per day doubled from 4 to 9. Due to clinical and reporting lags, these numbers may obviously continue to grow for this period. The community continues to experience early signs that more people are seeking medical care for COVID-19 symptoms. more people are visiting their doctors and being diagnosed with COVID-19. Between June 16th and July 2nd, the average outpatient visits nearly tripled, from 9 today to 25 visits per day. In recent weeks, over 94% of the cases are not in congregate settings, signaling significant transmission in the broader community spread. Clermont County also hit a new threshold, of course, as I said, for the overall utilization rate for regional intensive care unit beds, which exceeded 80% during 5 of the last 7 days. We'll move to Fairfield County. During the last 3 weeks, Fairfield County's COVID-19 cases have increased, along with several other healthcare indicators. Fairfield County reported a total of 85 cases per 100,000 residents during the last 14 days, exceeding any previous 2-week period. Over 20% of Fairfield County's total cases have been in the last 2 weeks. So a marked change in Fairfield. Due to clinical and reporting lags, these numbers, of course, may continue to grow for this period. More people are visiting their doctors, being diagnosed with COVID-19. Between June 16th and July 2nd, the average outpatient visits increased from 11 to 16 per day. In recent weeks, over 88% of the cases are not in congregate settings, signaling significant transmission in the broader community. Let's turn to Franklin County. And you will note in Franklin County, and we'll get to this in a minute, but we had them on the watch list. We have our data team has now removed them from the watch list, so that is a good thing. This week, Franklin County was removed from the watch list due to a decrease in the number of residents being admitted to the hospital based on a COVID-19 diagnosis, but it still remains as level 3 alert red. Franklin County has reported nearly 2,200 cases during the last 14 days, which means the county exceeds the high incidence category for COVID-19 as defined by the Centers for Disease Control and Prevention. COVID-19 cases have increased along with several other healthcare indicators. Beginning on June 16th, Franklin County had an average of 94 cases per day and reached an average of 175 cases per day by July 2nd. Due to clinical and reporting lags, these numbers may continue to grow for this period. The community continues to experience early signs that more people are seeking medical care for COVID-19. Between June 16th and July 7th, average outpatient visits increased from 171 to 302 visits per day. Similarly, more residents are also going to the emergency department for COVID-like symptoms, with average daily numbers growing from 27 visits on June 16th to 56 visits on July 4th. Lorain County. During the last 3 weeks, Lorain County's COVID-19 cases have increased. Lorain County has reported more than 160 cases during the last 14 days. Cases more than doubled from an average of 5.5 cases on June 6th to an average of 14 cases on June 29th. The community is also experiencing early signs that more people are seeking medical care for COVID-19 symptoms. From June 16th to June 30th, visits for COVID-19 to the emergency department doubled from an average of 3 per day to 6 per day. More people are also visiting their doctors and being diagnosed with COVID-19. From June 16th to July 2nd, outpatient visits more than tripled from an average of 8 visits per day to 26. And in recent weeks, over 91% of the cases are not in congregate settings, signaling significant transmission in the broader community. Recent community outbreaks include settings such as workplaces, a child care center, and a faith-based organization. Down to Montgomery County. During the last 3 weeks, Montgomery County's COVID-19 cases have increased. Montgomery County has reported more than 600 cases during the last 14 days, which means the county is categorized as high incidence for COVID-19 as defined by the Centers for Disease Control and Prevention. Case increases from an average of 41 cases on June 16th to the average of 50 cases on June 30th. Communities continue to experience early signs that people are seeking medical care for COVID-19 symptoms. From July 16th to July 2nd, visits for COVID-19 to the emergency room increased from an average of 9 per day to 16. More people are also visiting their doctors and being diagnosed with COVID-19. From June 16th to July 3rd, outpatient visits nearly quadrupled from an average of 14 visits per day to 48. Over 63% of the cases are not in congregate settings, signaling transmission in the broader community. The number of COVID-19 positive patients in the West Central region's hospital beds, ICUs, and on ventilators has tripled since the beginning of June. Recent community outbreaks include settings such as workplaces, restaurants, and nursing homes. Pickaway County. During the last 3 weeks, Pickaway County's COVID-19 cases increased, along with several other healthcare indicators. From June 16th until July 2nd, the average new cases per day increased from 1 to 4. Due to clinical and reporting lags, these numbers may continue to grow. Now, the community has experienced early signs that more people are seeking medical care. Between June 16th and July 7th, the average outpatient visits increased from 8 to 11. In recent weeks, over 81% of the cases are not in congregate settings, signaling significant transmission in the community. Pickaway County's recent outbreaks include a restaurant, a faith-based organization. Let me move to Summit County. During the last 3 weeks, Summit County's COVID-19 cases increased, along with several other healthcare indicators. During the last 2 weeks, Summit County had a total of 59 cases per 100,000. From June 16th until June 30th, the average new cases per day nearly tripled from 11 to 30. Due to clinical and reporting lags, of course, these may increase some. The community experienced early signs that more people are seeking medical care. For example, from June 16th to June 30th, visits for COVID-19 to the emergency department increased from an average of 5.5 per day to 8.5. More people are also visiting their doctors and being diagnosed with COVID-19. Between June 16th and July 2nd, the average outpatient visits nearly tripled from 11 to 29 visits per day. Summit County currently has faith-based, workplace, and long-term care facility outbreaks. Trumbull County. Let's take a look at Trumbull County. During the last 3 weeks, Trumbull County's COVID cases have increased, along with several other healthcare indicators. During the last 2 weeks, Trumbull County had a total of 68 cases per 100,000 residents. From June 16th until the 27th of June, the average new cases per day doubled from 8 to 17. More residents are visiting the emergency department. From June 16th to the 29th, visits for COVID-19 to the emergency department increased from an average of 3 per day to 8 per day. Trumbull County residents are being admitted to the hospital, with the average number growing from 1 to 6 on June 16th, from 1 on June 16th to 4 on July 1. Trumbull County currently has an outbreak in an apartment complex and several long-term care facilities. Wood County. During the last 3 weeks, Wood County's COVID-19 cases have increased, along with several other indicators. During the last 2 weeks, Wood County had a total of 63 cases per 100,000 residents. Over 18% of Wood County's total cases have been in the last 2 weeks. From June 16th until July 11th, the average daily new cases significantly increased from less than 1 to 9. Due to clinical, over 89% of the cases are not in congregate settings, signaling that we do have community spread. The community is also experiencing early signs that people are seeking medical care for COVID-19. Between June 16th and July 2nd, the average outpatient visits nearly doubled from 3 to 6 per day. Now, let me look here. We had a couple other things. John, I'm going to look at this map a moment. I'm going to refer to you, and then I'll come right back, and then we'll get to questions.
Sure. Good afternoon. And I have a few things on the job training, medical advancement, and sports fronts. And let me start with the launch of IMAP, which is a job training program. Many of you have heard me talk about Tech Cred, which is our effort to get employers to upskill the people in their workforce. And as people are trying to get back to work, If you look at the Ohio Means Jobs website, you see there's 120,000 jobs on there that are currently available. 60,000 of them pay more than $50,000 a year. But if you look, you're going to see that tech skills are an important part of landing those higher paying jobs that are part of our landscape. And so we're announcing today the $2.5 million grant opportunity under the Individual Micro-Credential Assistant Program, or IMAP as we're calling it. Today, this is for the providers to register so that they can provide these skills. The grant application is open to those training providers today. Those can be universities, colleges, our Ohio Technical Career Centers, and private sector training groups, because we know that there are a lot of them that are really doing a great job of getting the tech skills developed in their workforce. And this program was created in partnership with the Ohio Legislature last year. I want to thank them for their efforts. It will provide up to $3,000 of training reimbursement for an individual. And you can find out more information at imap.development.ohio.gov. We're going to ask the training providers first to go and apply for this, which will wrap up on July 24th, and then we'll have an announcement of how individuals can go about applying for this. But wanted to put it on their radar screen to get the training providers involved so that they can qualify for this and we can get people trained up to tackle some of these opportunities that are growing as we come out of the economic slowdown. And as we do that, I also want to highlight shared work and the shared work executive order that the governor signed on July the 2nd. This will allow the Ohio Department of Job and Family Services to draw down federal dollars authorized under the CARES Act for the shared work program. And I've talked about shared work before, but let me just give a quick review of this, because this is a great program for employers and employees. It's designed to keep people working. And we know that when you have an economic slowdown, that you may not have enough work for all of your employees, but you want to keep them on the job. You want to retain their talent for when the economy picks back up and you can use them full time. Well, this program, Shared Work, is designed for this kind of activity. And let me give you a few details on how it works. Employers who want to reduce staff and reduce their hours in a uniform percentage between 10 and 50%. So they're going to reduce hours for employees between 10 and 50% of a maximum of up to 52 weeks. This will keep people employed. At the same time, those employees will receive shared work compensation for the remaining hours, which is prorated as an unemployment benefit. So you can work, draw down your salary for that, and then for those hours that the employer is shortening that, you can draw down unemployment compensation. And the program is easy to use and gives a lot of flexibility to employers. Just so you know, since March the 15th, when we started to push this, 909 employers have used it. 1,680 shared work Ohio plans have been advanced, and that has allowed 46,352 employees to stay on the job and still have the opportunity to reduce their work and also get compensated for the hours that they're not working. So that's really working well to keep people employed in Ohio, and we want to keep that going. And then let me also add some good news on the medical front, and I want to remind people about plasma donation. On coronavirus.ohio.gov, under our checklist station, you'll find some resources about donating plasma. Convalescent plasma is very helpful. It's rich in antibodies that could be used to attack COVID-19 as a treatment for the severity of the virus and for the length of duration. People who have fully recovered from COVID-19 for at least 2 weeks are encouraged to consider donating. You can find more information on how to donate at redcrossblood.org/plasma for COVID. So go to the Red Cross website, redcrossblood.org/plasma for COVID, or you can contact any Red Cross local organization or plasma donor center. OSU's Wexner Medical Center is also a place that you can contact for ways to help. The Hawksworth Blood Center at the University of Cincinnati is another place that is also collecting it. You can find that at hawksworth.org. I know that Dr. Dean Kariakis at the Christ Hospital in Cincinnati, and I have talked about this many times, he's told me that even though this is in the investigative stage, that Ohio medical facilities are having success with this. So plasma donation, Ohio innovators in the medical care field are using this to help people not only survive when they're in difficult situations, but to even shorten the stay for people there who are there. And then finally, we talk a lot about sports and the return to play plan. Many non-contact sports have been active. We have a temporary order under specified circumstances to allow contact to go forward until the 15th of next week. We've launched the I Want a Season hashtag that we're using to try to remind young people that if they want to have a season, if they want to control the spread of coronavirus to their teammates and their family, they should wear a mask and socially distance. Very important. But we'll have more guidance. I know people want to plan. I know they want to, that when you think about sports and some of the contact sports that we don't have future guidance on, that will be coming next week. Wanted to keep you informed on that. We're trying to have these great conversations on what we're learning, talking with the sports organizations from around the state. That's Ohio High School Athletic Association, our college and professional teams, to make sure that we are learning on how to keep people safe, allowing them to participate, and we will be forthcoming with more information starting sometime next week. So that's my quick update on all of those topics. Please take advantage of the training opportunity. Please donate plasma if you've had COVID and you want to help somebody else out. So we'll conclude with that and turn back to the governor for a couple of more items.
Thank you very much. Just a couple of other comments before we get to questions. One thing to note on the map is that Huron County was moved down. Barely. It was that close, but you know, we're going to follow these numbers, and so that's a good thing. We're very happy about that, and we hope that that continues to see other counties get a lower level of risk. Also would mention we had 18 counties move from yellow to orange. Of note, Highland County met 2 indicators, which you would move it, but it still remains yellow because they're a low incident county. This means they have, under the criteria we've set up, they have fewer than 10 cases per 100,000 for a 2-week period, which automatically makes them, according to our order, a level 1 county. So apologize for taking as long to go through each county. I want people who are watching this from one of these counties to at least be able to hear. I suspect what we will do going forward is we'll try to be a little crisper in the summarization of the counties. This is going to be posted, a basic summary of each of the red counties. That will, in fact, be posted. So you'll be able to go online and look at that particular county. And again, we have some counties moving around, a couple of them in the right direction, a couple of them, some in the wrong direction. But the goal here is to try to keep you informed where your county is, the best that we can do that. We have data that we've shared with you, but we also want to put it into a category or again, a color that makes it easier, I think, to understand, particularly when you look at the map. And again, those counties that are on watch, we see Hamilton, Butler, Cuyahoga County, that means that they really, for 1 week, qualified to go into the purple. And we're not putting them into the purple until they do it 2 weeks. So we put a kind of asterisk there or a star there that designates that they're on that kind of a watch list. So, ready for questions?
Good afternoon, Governor. Randy Ludlow with the Columbus Dispatch. Obviously, with the designation of these new red counties, we have mask orders expanding farther still. Why did you feel the need for the first time during this pandemic to directly regulate people attending a religious gathering, and why are you convinced this is allowed under the First Amendment? What specific examples of COVID spread can you cite from religious gatherings that would require all congregants to wear masks?
Randy, that's a very good question. And one of the things I want to assure everyone is that Ohio has been a leader in this, in the sense that we have never, ever closed down any religious activity. None. We do not intend to going forward. We have not regulated in any way funerals. We've not regulated baptisms, marriages, anything. And it's because we thought that was the right thing to do, that this is a great tradition in our country. And we are not in any way prohibiting anyone from going to church now. What we are simply saying is that we do have examples, and Randy, I'll get you the examples, but they're certainly been reported in the Columbus Dispatch, they've been reported in other papers, and I can tell you from talking to our health director.
Because you'd want to know. Why would we want to live life in the dark? Why would we want to encourage people not to have information about their health status so that they could then be empowered to protect the people that they care about? Testing is one of the few things that we have to control the spread. And when you control the spread, then if you're building consumer confidence, you're protecting your loved ones, you're doing everything that helps protect the health and the economic future of our state. So everything that you can do to help one another, whether that's testing, wearing a mask, social distancing, is about them. It's not just about you. It's about protecting people, protecting the economy, and you know, nobody's mandating you get a test, but you ought to do it to try to help.
Thank you.
Hi, Governor DeWine. This is Farnoosh Mary from the Associated Press. On Tuesday, you required a mask mandate in 7 counties, and today you said 12 counties. So in addition to those 7 counties have been labeled red. Will that change the mask mandate? And for Huron, that was lowered to a level 2. Will that change your mask mandate in that county?
You know, this, by the way, I didn't say it. Thank you for reminding me. This goes into effect tomorrow night at 6 p.m. for the additional counties. So red counties will go forward. As we saw in Huron County, when a county moves out of red and drops down, when it drops down, then the mask order goes off. Now, we hope people in Huron County will, because they're right at the bubble, frankly. We don't want them going back to red, and we hope people will use this kind of cautionary information and continue to mask up. But we're going to call it like the numbers are, and we're going to inform people where those numbers are. They're very close for Huron County, but they're slightly under until they move back. They move back to the lower color, to orange.
Thank you.
Update on the antibody test? I'll provide quickly. The study began last week. They mailed out 12,000 postcards, invitation letters. On Monday, they began testing the workforce, which will include the recruiters, interviewers, and nurses who will be conducting the test. Training began for them on Tuesday and Wednesday. The teams will be in the field collecting samples today. This is the actual first day of this. They're going to be starting out in Central Ohio. The goal is to collect 1,200 samples from individuals statewide. They'll do it as fast as they can. This will conclude, they hope, by the 28th of this month as they go through Central first, Southwest and West Central, Southeast and Southeast Central, Northeast, in East Central, and then Northwest Ohio. And that will give us a snapshot of that during that period of who may have had COVID, who have antibodies in their system, and hopefully that will give us the information we seek, and that will hopefully answer Jack's question from earlier in the news conference. Thank you.
Hi, this is Jessie Belmert with the Inquirer. My question is, how do you get buy-in or people to change behaviors in perhaps less populous counties where they see comparatively small numbers like 2 ER visits a day going to 7 ER visits a day in Butler County, which has 380,000 people?
Well, we're seeing more people wear masks. That was occurring as anecdotal. I don't have any solid evidence except just what I'm getting reported from talking to different mayors and talking to different officials who are out and about. I think people are beginning to understand that we don't want to end up as Florida. We don't want to end up as Texas. God love them and their citizens, but we don't want to see that. We don't want to see Ohio on TV like that. We don't want our citizens to have to go through that. So I think what these do is they give you a real indication of if you've got a problem, if you have a trend, if you have a serious trend, things going in the wrong direction. And the whole idea behind them is to get people information so that they can say, okay, look, I might not have been concerned when we were at orange, but look, this is a new level. The indicators are going the wrong way. And so I think you're going to see more and more people who will, particularly in those counties where they are red, I think more people will start wearing the mask. The law is a teacher. It is what we're trying to do is we don't have to change everyone's behavior. We know there'll be people out there who will not do that. We understand that. But if we can get 75 to 80% of people who are actually out in public, who are interacting with other people, to wear a mask, we will beat this thing down. It will make a fundamental difference. It will change the fall. It will change the winter. It will make a difference. No single act will change everything, but in combination with keeping distance, washing your hands, wearing a mask, kind of thinking twice about what you do, where you go. Those things are all within the grasp of all of us. And I guess I always try to take the long view. We're going to get out of this. There is sunlight out there. We are going towards it. We're going to make it. And frankly, we all want to be there when this thing is over with. And we want our loved ones to be there. And we want our neighbors and our friends to be there. And to do that, we've got to make some changes in our lives. We have to live with this virus. We don't know how long we're going to have to live with it. We're going to have to live with it for a while. And the other thing I would say is that I know there's some fatalists out there who say, oh, well, everybody will get it, or X number of people will get it, might as well get it over with. Well, that's just ridiculous. And it's ridiculous because look how far we've come when this started. Look what doctors know today. Look at their ability to treat people who are very, very, very sick. They don't save everybody. We know that. But they're saving more. And if it's a choice of getting it today or 3 months ago, you're better off getting it today. And if it's today versus 3 months from now, you're better off 3 months from now. So we are all in this together. We can get through it. There's all things that each and every one of us wants to do with our families, with our kids, my case, our kids and our grandkids. A lot of things I want to do. And so just being careful, thinking about other people, not spreading it, I just think the more people analyze this and think about it, and the evidence is just absolutely overwhelming, that you're going to see more and more people who are going to comply. Will everyone? Certainly not. We know that. But if we can get 75 or 80%, we're going to knock this thing in the head pretty hard. Thank you.
Hello, Governor. Jim Province with the Toledo Blade. And continuing with the face mask issue, I know that you want everybody to wear a face mask whenever possible. But does this face mask order apply to non-residents of these counties who are either passing through, stopping at a gas station, maybe going to dinner in a neighboring county? And is that one of the reasons that, at least initially, you preferred statewide orders as opposed to county-by-county orders?
Well, Jim, it's a good question. I mean, look, you can you can argue this either way. We've kind of come down in the middle, frankly. We have some state orders that apply in every single county, from Monroe County to Cleveland, Cuyahoga County to Hamilton County, and those are kind of baseline orders. No large gatherings. Keep your distance, etc. Those apply everywhere. But there was an argument, there is an argument, that the data is different in different counties, and that what goes on in a very rural county in Ohio, now what goes on down here, you pick the area, is different. And that while we have orders that in business, doesn't matter what county you're in, you have to wear a mask at that business. But if you're out in public, it made sense to impose it for those counties that are at the highest level of risk. Now look, you know, and everyone knows, that the business group that we put together, health/business, came back initially with recommendations that not only everybody in the workplace should wear a mask, but everybody in public. We put that out there, and it was abundantly clear that people of the state of Ohio were not ready for that. So what we have done is we waited. The situation is more serious. We now have the ability to target those counties with data. We can tell by data those counties that are most at risk. And to say, okay, we're going to have this face mask order for these counties that hit red or hit purple. It is something that I think the majority of people will accept. Not everybody will accept it, but I think the majority of people will accept, because it's based on data. It's based on evidence. And we're not saying everybody has to do it. If you're in Monroe County, you don't have to do it. Or if you're in another one of our great counties, Ross County, Pike County, etc., you don't have to do it. But if we're at this level, then you need to do it. So it's kind of the way of getting at the problem in a way that I hope is acceptable to the people of those counties. They can work their way out of this. We would love for them. Nothing would please me more than to look at that map and see no purple and no red. I would be delighted. So that's why we did it. And again, our destiny is in our own hands as we move forward here.
And are non-residents expected to comply when they're in those counties?
They should. They should. Look, I mean, we're not talking about throwing people in jail. This is a law that, you know, is there to advise people what they should do. Most people will follow the law. Most Ohio citizens will follow the law. If somebody happens to be in a county that is red, and they come out of a county that is not red or purple, look, they're going to get a break. You know, virtually everybody's going to get a break, and people are going to be asked, will you just put a mask on? And I'm sure that the stores and restaurants will have an extra mask, and they'll just say, here, put that on. So this will work out. Ohioans can figure this out. We can work this out.
Thank you.
Tom Bosco with ABC6 here in Columbus, and I've been informed that this is the last question of the day. Back to colleges and universities. You know, we already have people on college, or young people on college campuses with sports resuming and getting practices underway. We've already seen Ohio State has stopped practices for 7 teams because of some positive COVID tests. We've seen this with sports around the country at other universities. Is this a kind of a canary in a coal mine, or an indicator that getting schools and universities back open may not work?
No one said this is going to be easy. This is not going to be easy. We have congregate living in at dorms, but it's also not what not only what goes on in the classroom, but it's obviously what goes on in young people's lives. Young people like to get together. We all know that. So yeah, this is. We're going to have to see how this works out, and colleges are going to make their own decisions. They're going to look at this. I've been impressed with our colleges in Ohio, their preparation for this, what they're doing for this. They know, quite candidly, that they have to sell this to parents and to students that, you know, they are providing the safest environment they can provide on campus. There's always a risk, and we know that. But I think there's almost a competition, and Ohio colleges and universities have risen to the challenge, and they're all setting up their own criteria and exactly what they're doing. We've worked with them, as I said. Chancellor Gardner has worked with them very, very closely. He is very impressed with what they've done. I've been very impressed with what they have done. But it's not without risk, and it's not without, you know, trapdoors and pitfalls, whatever words you want to use. And so, yeah, we don't know where this is going. Again, this virus, we know it's dangerous. We know it spreads well. But, you know, we don't know where exactly it's going to be in the fall. And I'll just conclude before I say goodbye to all of you until next Tuesday at 2 o'clock. But again, we can control some of this. We can control some of our future, how things are going to be in a month. And the more Ohioans will wear a mask out in public, the more Ohioans will keep their distance, the better off we're going to be. And finally, please get a test. If you have an opportunity to get a test, get a test. One of the things I was talking to General Harris about this morning with our Ohio National Guard, we are going to look at those communities where the local officials tell us we have not had enough testing here. We've not had the availability of testing. It's not been easy enough. I told the general, look at some of our mid-level counties in size and cities, and see if, you know, they want us to come in. We're going to be guided by what local officials say to us. And if local officials want additional testing so that they can cut this virus off at the knees, which is what testing can do, and why you do testing, as well as for the individual who's being tested, so if they can get their proper diagnosis. So I would invite any mayors, any counties that again want us to have the Guard to come in for a day, do a pop-up test there. We're happy to do that. We're happy to help. So we'll see you all. We'll see you all Tuesday at 2 o'clock. Thank you very much.
Governor Mike DeWine wrapping up his news conference on this Thursday, talking about, of course, the numbers here in the state of Ohio and encouraging people here in the state to go out and get tested, to wear a mask, practice social distancing, because we're dealing with some pretty serious numbers. On Tuesday, we were only talking about 7 counties here in the red. Now we're talking about 12, and there's a couple in purple, which means the governor says, in more trouble. Let's look at the numbers real quickly, Brian.
Yeah, we take a look at the numbers, which 1,150 since yesterday, and 3,006 deaths as we move into that number, which is another 15 more deaths that we have. So you talked about those 12 counties that are now in red, 2 that are on the verge of going to purple, those both in the Cincinnati area, in Hamilton County and in Butler County, who are on the verge and could be moved to purple, but they'll wait another week. The good thing for Franklin County, it's been moved out of the watch list.
Just a little bit, he said.
Although 2 more counties right next to Franklin County and Pickaway and Fairfield have been added to the red.
Right, and he did also mention earlier this week that we had Huron on the list. It has now been taken off of the list, so that's a good thing. But he said, that does not mean not to continue to follow the orders or the guidelines that are already in place right now. So
and the nice thing is that we're going to have a little bit more money for colleges and for K through 12, as he talks about another $2 million in federal money being able to do that, and another $100 million for K through 12, $200 million for the higher education.
Yeah.
Money is going to have to be able to drive some of the universities.
Well, we've heard, of course, here at NBC4, we've heard from Dr. Talisa Dixon, who talked about how much more this is going to cost to make sure that there's masks, that the students have masks every single day, that they're practicing social distancing, and that desks are set up. So they got to make a lot of changes, and those changes are going to require some money. Let's toss it on out to Dan Perlman, our colleague there, who was inside asking questions of the governor. Dan?
Yeah, Darlene, the governor's briefing just wrapping up within the last couple of minutes, as many of you just watched. The highlight today is that 12 counties are now on that, are now listed in the red, level 3 red on the Ohio Public Health Advisory System. Of those 12, Franklin County remains in that red level. That means there is very high exposure for COVID-19 here in the county. But on top of that, 2 of our neighboring counties, Pickaway and Fairfield counties, also on that list for red level 3. Again, that means that there is very high exposure of the virus here. Now, I want to point out, this is what triggered the mask mandate, which went into effect from the state for Franklin County here yesterday. What this means is that there will now be a mask mandate beginning tomorrow for both Pickaway and Fairfield counties. So if you live in one of those counties, that mask mandate goes into effect tomorrow. I also want to point out one thing we've been talking about is that Franklin County was listed as approaching level 4, meaning that there would be severe exposure here in the county. Franklin County is no longer on that list for approaching red level 4. Of course, as you mentioned a little while ago, the governor also talking about reopening schools a little bit today, talking about how he's working to secure funding for schools to do that. He really spoke at length about colleges and universities, saying the state will release its guidance for that. Today, the highlights will be focused on testing and isolating those at colleges and universities who show symptoms of COVID-19. So right now, 12 counties on listed at red level 3, Franklin County, Pickaway County, and Fairfield County, 3 of those 12. Brad and Darlene.
Dan, I want to ask you before we let you go, you're wearing a mask. You started wearing it yesterday, right before, of course, that mandate kicked in at 6 o'clock. Are you seeing a number of people out in the streets, there where the governor is holding us, where you guys are, where the reporters are? Are you seeing people wearing their masks now?
Darlene, everyone is. Very few people.
Wow.
A couple of state troopers came by. Of course, they are exempt from that order. Outside of that, everyone here at the State House is wearing a mask.
All right, good deal. Dan, thank you so much for that update out there with the governor. It's interesting because the governor did just say, imagine if 75 to 80% of the people living here in the state of Ohio did what they're doing right there, put on their mask. He said, I can't make you do it. I'm just saying it's what we should all be doing to get those numbers down, because he doesn't want to have to rewind the tape and shut the state back down.
He said, what we do in the next 30 days is frankly going to determine what the rest of our year looks like. And that mask wearing, if it's that simple, even with its inconvenience, is going to bring us football in the fall.
Right, a school year.
Is going to bring us a school year for many colleges. I think people might, if they could understand that that inconvenience is there, might change their habits.
Absolutely. It's a lot going on here. We'll have it all for you wrapped up at 4 o'clock. First at 4 for now. Darlene Hill, Brad Johansson. We're going to send you back to Ellen. We'll see you in about 30 minutes.